Let's start. What happened first?
Breast lump.
When did you find your first
I
lump?
think it's about 6 months ago, but the doctor said the lump could be longer than 6 months.
6 months ago, you felt the lump. So only 6 months ago you
Then start feeling.
but you didn't bother. So anyway, you went to see the lump, see the doctor, and then he did the
mammogram, ultrasound, plus the biopsy. Yeah.
And then what did she say?
He said have to remove it totally, and then but before doing so, he want to shrink the tumor size first. So that's shrink the size of the tumor, reduce the size of the tumor. So that's why he referred me to the oncology, and I spoke to the oncologist just now.
Yeah, they went to see the oncologist.
Suggest to do immediately for the chemo treatment, 3 treatments.
Chemo immediately.
Yeah, for I think a stretch of 9 weeks. And that means you do one treatment, you rest for 3 weeks, and then follow up the second, and then 3 weeks, and then another.
After that,
Ask me to decide, you know. So yeah,
after that, they have to do the second. They want to do the surgery after
he said it depends on the result of after the 3 treatments. You're going to remove entirely. Why you have to do chemotherapy? So he said it's because of the size of the tumor is so huge. They want to make sure that the skin is clear, so that when they cut the area, the skin is free from the micro virus or whatever. So make sure it's clean. Surgeon. GH.
Why did he ask you to go to it?
Because he said if let's say it's a removal, then must as well consider a breast surgeon.
A breast surgeon. So did you go and see him?
Yeah.
What did he say? What did he say?
He also say have to do. No. No, he didn't say no need, but he said you remove only then check further. I said I want to consider, in order to go for a chemo, I just want to make sure that, I think properly before I commit.
Yeah.
So I said, chemo cannot guarantee a total healing, probably will recur a few years later.
Yeah.
So the do you have any disease that can cure? Like hypertension, diabetes, it's just maintaining.
Or do you have, he tell you, do you have any disease that can cure? But when you take diabetes cannot cure. But you take diabetes pill, diabetes don't kill you. Chemo can kill you. Oh, that's this argument they gave. I always teach people to ask the doctors back, can you cure me or not with the chemo? The answer is?
He said have to check after they fail the chemo.
Have to check after chemo. But that's not an answer.
I'm also not sure. What's the stage?
Let me ask you. If every day you see people's breasts, every day you chemo people, you cannot give an answer. Are you an expert? If every day you see people chemo, and you cannot tell people they can cure or not, do you think you are an expert or not? ลูกใช่ไหมแต่ที่ผ่าตะเบียว then why in other words the answer is always
to be honest, to be fair to the doctor as well, because when you do chemo, after that a lot of times it is your own discipline, whether you want to control your food and things like that, which I find this is something beyond the doctor capability, to educate the patient. So that's why they don't have the confidence to tell you, whether it's a total cure or not.
Do they ever teach you how to win the game?
They will not. But if you ask further, they will probably refer you to the wellness center or see the dietitian.
Do they ever teach you how to get well? They don't. And they tell you, go and eat anything you like. That's wrong. We just come here, we teach you not how to get sick. So it's a hard way to come and see me. One day I'm going to scold you, I'm going to bang you, I got angry with you. One fellow went to eat McDonald's, my wife was very angry, and then tomorrow she comes and say, I'm very sorry, I don't want to take anymore. You see, we are very angry because we want to teach you so that the cancer don't come back. The second thing is, if you ask them, they don't know the answer. They don't know how to make you well. They only know how to cut your breast only. And as far as he's concerned, he only know how to chemo you only. Anything come, hammer, chemo you. Like a hammer. Anything come, tong. Look at the nail, no? That's it. Because they do not learn how to make people well. Well, but I cannot say much. Alright? Now, is the lump there? You can feel the lump? Yeah, it's big. It's quite big. My advice then is that remove. He says shrink. I go to chemo first and then go and cut. Dr. Chong says no need. Take everything, cut first and then we counting later on. Two experts tell two different stories. Okay? Why like that? Okay. If you ask me, my advice to you is first, go and cut. Remove it. Alright? After you remove, definitely they will ask you to do chemo. But I cannot tell you don't do chemo. Alright? But if you don't want to do chemo, then you come and see me. As simple as that. Now, of course, were you hoping to come and see me that I say no need to cut?
Yeah.
Very disappointed. I'm going to be very frank with you. If there are big lumps, there's no way the herb can help you. It may be there, the lump is there, but one day it will fall out. Pop to that.
Yeah.
Then there's a big hole. I susah also. So how to take care. So my advice to you, go and get cut clean so that we don't worry about that lump anymore. First. Second, psychologically also. Every day you see the lump there, take the lump there, take the lump there, what is this? Then one day you say, TC, I go. Be boy. Because let me ask you, the lump is there, where to run away? It's there, it's there. Okay? The only thing, one day you come out, broke, pecah, susah. So it's better to remove it, clean. Alright? That's my experience. I will advise anybody to do that. So, yeah, I know some people come hoping that, oh, still will say, don't cut. I say no. Because experience telling me that the reason is that I'm here trying to help you the best I can. I always tell myself that, what if I were in your position?